No, okay, you gotta help me with your hair then. Okay, yeah. Hey everybody, welcome to our show. Of behavioral issues in children and how they can be really turned around fast, and what is the relationship of that to autoimmune disease? You have to watch. And what is the role of that in autoimmune disease? And tonight we have joining us Elsa Kirkman. So give me 1 second, and what I want to do is tell you guys, if you want to join in on the conversation right now, go to drmaggieyu.com/. And what I'd like to do is introduce Elsa Kirkman. Elsa and I actually, Elsa works for with our company, and Elsa is a client coordinator in our program. And this whole conversation started with our conversation we had at lunch the other day. And Elsa, I'd like you to introduce yourself, and her girls had gone through our program, and it was just a really important conversation that she wanted to bring to light to our audience of how much behavioral issues can be turned around in children. Elsa?
Hi there, nice to see everyone. I talked to a lot of you on the phone, and it's just fun to see faces and to be able to share my story with you. I talk a lot about Dr. Maggie's story and other stories. What happened with my daughters, are you hearing feedback, Maggie? It sounds really weird on my end.
No, I'm not hearing feedback, but we'll talk about it in a second. And I want to start with some a little framing for people, which is that Elsa's daughters had actually gone through our program and then gone through the testing that we've done in our program as well. And she was just telling me about her daughter, Ani, and I think it's just a really powerful story to actually demonstrate how behavioral issues can absolutely be turned around and how quickly that happens. Elsa, take it away.
Okay, yeah, so Ani is my youngest of three. She's just turned 7, actually, but about a year ago, we started to see a shift in her behavior, and, you know, she was a great toddler and was really easygoing, kind of the typical easier third kid, go with the flow, and we just started to see the shift happen midway through last year. And we, you know, it progressively got worse. So, of course, I just, you know, tried different parenting skills, tried taking away the iPad, tried restricting her in other ways, just thinking it must be the environment, it must be the way we're parenting, it must be friend dynamics happening that are changing. And that went on for about 6 months. It just continued to get worse. And because I have autoimmune issues and my other girls do, I started to just learn more about, you know, I started to look into what is she eating. And luckily, I happened to have the fortune of getting to know this program at about the same time, and was able to really go from a kid who, you know, on the group, I posted a picture of her at Disneyland next to a garbage can, no jokes. She was just like hell on wheels. It was awful. It was the most horrible day experience of my life. And that continued for months. She was just like, I kept saying the spawn of Satan, and I hate to even say that about my child, but I was so at a loss with what to do with her. And it all came down to getting clear data on food was like the linchpin for her.
So, Elsa, let's talk a little bit about it, because you said that the kind of behavior issues we see in our program that people come in with, I mean, literally, day to day, I think Ani said some things, like she said she felt like there was like 2 pieces of her. You said that, yeah.
She had, she started the day off really moody, just like fire, right from the beginning of the day. She would then, you know, have a really rough day at school. Every day was like the worst day ever, she would tell me. And by nighttime, it was just a fight to get through the last few hours of the day. I mean, she was kicking, screaming, throwing tantrums. She had anxiety about school. Her stomach physically hurt from it. It started to just manifest in other ways as well, not just her behavior.
So and this is not uncommon. What we see is that people with autoimmune disease have children that have a much higher rate of behavioral issues. So what I see, for example, spectrum disorder, ADD, and ADHD is really high among people with autoimmune disease. And you guys have probably heard me say it before in some of the other videos, but it's clear to me that a lot of these diagnoses are actually, they're just targets of autoimmune attack manifesting in children and showing up as behavior. And to me, it's really clear that diagnoses like this, and even depression, anxiety, insomnia in children, is actually part of the spectrum of autoimmune targets that are under attack. Now, one of the things I think this was going on for a year, and was it interfering with her schooling and with socially and her relationships at home? How severe was the impact of this for at least the entire year, was what you said?
Yeah, absolutely. The impact was not just on us at home, but that trickled down to school. She was really challenging at school with her peers, and before that, she was a slow student. You know, they loved Ani, and she became a very difficult child. I got a lot of phone calls. She hit a kid at school. She started to just not even want to go to school. She wouldn't even go. She'd refuse. And the only way I could possibly get her there would be to physically constrain her and shove her in the car. So she missed a lot of school because of that. Because, of course, I wasn't going to do that.
So we see this in our program frequently. So we've had people through our program, families through our program, where some of them have had diagnosis like autoimmune, like JRA, or a lot of people are dealing with PANDAS in their kids or PANS. But there's also kids in our program that have OCD and are autism spectrum or ADD, ADHD. And so tell me about the turnaround, Elsa. How quickly, what did you discover in our program, and how quickly did things change as a result of this? I want people to understand how dramatically things can change and how fast.
Yeah, so two things were big. Blood sugar balance was huge, but really learning the right way to do that. I thought I had been doing that right, and I wasn't at all. And then for her, the big key factor was doing the food mapping process. That was a huge shift for us because we got clear data on exactly what foods were not, were feeding whatever attack was happening in her. And we were able to, with certainty, with the help of, people who actually knew what they were looking for. When I look at the tests versus, someone else who actually is educated and trained on that, I really learned how to use that information as a tool to guide us through shifting her out of this zone. And it took literally like 3 or 4 days to get my Ani back. It was
what did you find? What specifically was the food item that was causing this problem to shock the hell out of you?
Whey protein.
And what was she drinking every day?
She was drinking whey protein shakes twice a day because that's all we could get in her mouth.
And you stopped the whey protein, and in 4 days, what happened?
In 4 days, she came home skipping, would skip to the car, 2 thumbs up. We always rated the day with thumbs up, thumbs down in the middle. It was double thumbs up every day. School was the best day she had had. Just at home, there was just a peace and an ease. It was literally just 4 days in. It was a huge, huge turnaround.
Hey, Elsa, you told me at age 4 she said something to you. What did she say to you?
At age 4.
No, at day 4, you said that she noticed a difference. She noticed a difference, and she said something to you.
Yeah, so she was kind of grumpy one day, just moody about something, and I started to panic. I was like, oh no, maybe this didn't work. And she said, Mom, I'm still going to have some bad days. It's not always going to be my intolerance. So cute.
But you were saying that even within a couple of weeks, she was having all these good days, and she was starting to get a little grumpy and irritable, and you were like starting the whole spin cycle of anxiety yourself.
Yeah. And even the other day, my husband, because I primarily, this is why both parents should get involved in the process. My husband wasn't educated the same way I was, and so he didn't put as much weight on the whey as I did, and didn't see had the same experience. And he bought her a milkshake the other day, and that evening was hell. It just was an overnight, again, I mean, just like night and day difference. Like Ani reverted right back to where she was just with a milkshake. And she the next day said, I am never doing that again. I don't like how that made me feel. I don't like feeling angry and upset like that. So it's for her to realize that now too is huge and empowering for her going forward and making choices.
So this is really huge. One of the biggest problems as parents we deal with kids' behavior issues or health issues is that we think we have to, like, how can we make our kid do this? And to me, it's really interesting because when we deal with really young kids, well, they're held hostage by parents because we control their diet completely. But there's this age range where, like between, anywhere from 7 to 50, where we really don't have any control and it's really influence. And this is why, for me, education is so important, because teaching not just the parents about cause and effect, but when you have a child, because when you have a child who's 6 or 7 years old and they know the cause and effect and they're making intelligent choice and they're choosing, that totally takes the pressure off the parents, because you've just educated your child on cause and effect, which is the most powerful tool.
Absolutely. And now she knows the difference between, whey protein and the proteins in cheese, and she understands what she can and can't have and what the different foods do to her. She also learned the impact. She's also intolerant to gluten. It does not have the same effect as the whey does on her. It manifests in different ways. So she really has choice going forward, and that makes her want to choose the better path, because she's empowered with that decision making, but also the knowledge that goes with that. And that carries through for the whole family now. Just getting educated on this has been huge for everybody.
Well, I loved what you said. Ani said something to you about doing this as a family. I want to hear that story. I want to hear that comment and story.
Yeah, she's been a little disappointed that Dad, who has ADHD, is not doing his intolerances, as she says. So she wants to do a family challenge for a month where we all adhere to what the information, gave us, and wants her dad to cut out his eggs and his whey and his gluten as well, because he's not so far. It's pretty cute that she wants to get everyone involved.
I love this. What I'd love to do is, those of you who want to join, we have some time for some questions. Feel free to click the link, drmaggie.com/live, to join us right now. And you can come in and ask us questions face to face. And right now, we have a comment actually from Andra Jean. Does autoimmunity really exist, or is it all inflammation and infection? Yes, autoimmunity 100% exists, Andra. That's why we actually have diagnosis of rheumatoid arthritis. I have Hashimoto's. There's blood work actually diagnosed tons of us with autoimmune disease. So of course it exists. It's real. There's medical evidence and studies and years of treatment and behind it. So that's not really a question. That's a fact. However, autoimmunity does cause inflammation and can be related with inflammation and infection. So those can be secondary effects as a result of having autoimmunity. So that's a good question. And they're all tied together, which is one of the reasons why we put it all together in our program. And we train people like you, real clients, on how to actually put all these pieces together: the inflammation, the infection, the autoimmunity piece, the blood sugar, the food testing, all of it. So Heather Jackson has a question in our audience, and she says, food mapping and what else? So Elsa, I love what you had said about, it's not just about food mapping. The order of how we approach autoimmunity actually really makes a big difference, because you mentioned that there's a history in your family with trying to deal with infection first. Can you talk about that?
Yeah, for sure. My oldest daughter also has autoimmune issues, and it's nothing diagnosed, but it's clear that it's autoimmune all over the place. But she was trying to clear gut infection for a long time with a functional medicine doctor, but never got the food mapping process done. And so it was years of her taking supplements and testing and really on a really restricted diet. And she's 17 right now. So this was when she was about 13, 14, which is really hard for a teenager to be so restricted and handfuls of pills. And she was just in so much pain and bloating and everything for so long. And now we're able to do it properly in the right order, looking at all the pieces of the pie and really fixing all of them in a way that now supports, the gut in healing and ridding of infection. So order matters for sure.
I love that. Patricia in our audience here has a question. Go ahead, ask away, Patricia. Thanks for joining us. And those of you who want to ask us questions live, hop on the link right now and join us, drmaggie.com/live.
Hi, Maggie. I have a question, but I have a 17-year-old daughter, and she sometimes experiences anxiety. And sometimes I think it's a little bit more than I would think is normal for a teenager. And I'm wondering if you've seen cases in kids or teenagers where food intolerance has impact in with the behavior resulting in anxiety.
100% yes. Okay. It's absolutely a link. That food intolerance is linked to depression, anxiety, ADD symptoms, brain fog, focus. However, here's the thing. I mean, over the years, I've gathered a huge populations of kids that I've treated. And what I found is that, yes, the food is really important, but you are an alumni in our program. You've done our program as well. And what I find in teenagers are really important is also, guess what? The hormones. Mm-hmm. Especially girls going through their periods starting the first couple of years of that, the hormone fluctuations in that causes a huge mental health shift. And I know that myself, that was a huge trigger when my depression and anxiety started for me, was between the age of 13 and 16 when my period started. So hormones is a huge factor in teenagers, okay, in mental health and behavior. And we know this because as women going through perimenopause, what happens? Many of us get anxiety we've never had before. We get irritable, we get brain fog, we get fatigue. So hormones matter for us, why women matter for our children, right? So hormones is definitely another piece. And then the other piece is blood sugar. You've seen all the people through our program as you've been going through the program. How many people in our program as adults was directly, their anxiety was actually not even anxiety, it was a result of bad blood sugar issues.
That's true, probably everyone.
Right? And you saw that, when you were going through our program. I have Dawn's in here. She's an alumni that went through our program, and for her, blood sugar and ADD symptoms was huge. And if you guys haven't seen Don Sharp's interview in the Facebook group, we can post a link to it. Join our Facebook group, and you could actually watch some of these interviews with our alumni. Patricia's been on an interview with us. Don has been through an interview with us. Don found that she completely got off ADHD medication after dealing with her hormones, dealing with her blood sugar, and dealing with her food intolerances. So that was huge. And she's got all her kids have ADD and ADHD. So there's a huge link. Every piece of the program that we're doing is huge in behavioral issues. And in children, guess what? That behavioral issue is even more pronounced, and it's even quicker to turn around because they are not dealing with a lot of the permanent damage that an adult has. So this is why, in Elsa's case, her daughter was able to turn around in 4 days. Right? Dawn says, experienced it today when I wasn't watching my blood sugar. I'm going to mute you, Dawn. Dawn? There you are. So, Dawn, can you tell us what you've been, because we have a big interview that we did with you where not only did you discover blood sugar was key to your ADD symptoms, but now you got kids, adult kids that are dealing with it.
Oh, absolutely. Yeah. And it's something that I have to consciously be aware of. We all, as mature adults, have to watch our choices throughout the day, whether it be our thoughts, whether it be what we do. And what I eat, when I eat, and what I put into my body greatly affects my entire day. I can feel when my blood sugar is going down or whenever it is down. And by the time that I can feel it, it's already too late. So keeping conscious of where I am, what I'm doing, and making sure that I've got my balance that my body requires is crucial for me being able to function.
I agree. And then, in your interview, you talked about how you used to be on a ton of ADHD meds, ADD meds, and you were just in 2 months able to get off all those meds.
Yeah, I was on for 23 years, and gosh, Maggie, I've been off of them for a year. Thank you.
You're welcome.
Yeah.
And we cannot, and through learning how to put all these pieces together, not only can we do this for ourselves, we can do this for our kids.
Yes, we can. Thing is that whenever they're younger, as you said earlier, we have more control. But whenever they start, like my 18-year-old, he's about to graduate high school, and he's like, okay, Mom, I'm ready. I'm ready to do what I have to do. I'm ready to do what I need to do. Because he's seen what I am going through, or what I went through and where I am now. And he's seeing struggles, and he suffers from anxiety and things such as that. And so finally, it's not just Mom telling him. He's like, okay, I'm ready. And that's huge. That's power.
It is. Heather Jackson just commented on our Facebook post that my son was diagnosed with ADHD, but I think it's something more. He's super argumentative, loud, obnoxious all the time. Have you seen preteens boys like this? And I'm going to tell you guys, this is where the link with autoimmunity is huge, because honestly, I feel that myself, my son, and many people and their kids are actually misdiagnosed as having ADD or ADHD. You have to understand, there's not a blood test for ADD or ADHD. It's just a set of behavioral issues. And the cause of that, I have Hashis, and my son was, they put me on ADHD medications, and they put my son on ADHD medications, and it didn't work. You know why it didn't work? And even if it works, right? But it didn't work because the underlying issue was autoimmune related. So it's just a catch-all label that we have these labels. But when you look at ADD, ADHD, anxiety, autism spectrum disorder, all these are labels we give to basically, I have not seen a kid with some of these diagnoses that didn't have one parent that actually has autoimmune disease, whether you know it or not. So this is an early manifestation of autoimmune disease in your child. That is reversible. Do you hear that? That's reversible. And the earlier you do it, the better, because you're preventing permanent damage from happening from the autoimmune attack. This is why this works so much. Christina Chen is joining us, and I'm going to ask you, you're in our green room, and you had said that you have experience with this. Tell me about this, Christina.
Yeah, definitely. For me, the autoimmune issues first flared up when I hit puberty, and in fact, it kind of complicated the diagnosis because the doctors kept saying, "Oh, it's just puberty. She's at that age. That's why she's moody, and that's why she's having these, these aches and pains and the fatigue. It's all part of the, process." And then it flared up again as I've gone into perimenopause, and that's when I came to you. But it was definitely, of course, I run through the program that anytime you're in a point in your life where there's huge hormone shifts, you're at greater risk of these autoimmune issues flaring up.
Yeah, and what autoimmune disease is that autoimmune disease is basically your immune system is looking at a part of your body like it's a germ, and it's actively trying to kill those cells. So to a certain degree, our cells have resilience, so it can, if it's early damage, it can repair itself, right? But at the same time, over time, it can be permanent damage. So for example, ADHD symptoms in a kid versus ADHD in a 40-year-old adult is very different, because the amount of time the autoimmune attack has to cause permanent damage to your brain cells is much longer, and there's a cumulative effect in a 40-year-old versus a 6-year-old. And so the sooner you intervene on it, the more ability you have, because what happens is, as you go through time, the amount of damage, think of a graph, the amount of damage over time of those cells in autoimmune disease it gets to a point where it's permanent. So then, as a 20, 30-year-old, let's say you're going through this program and actually doing it, there's like a certain percentage of your cells that are never going to come back. So to me, timing is key, and the earlier you intervene, the bigger, faster, and more dramatic the turnarounds that we see.
Absolutely.
And Christina, you know what really thrilled me about you going through the program was how your whole family got involved with this.
I happened to homeschool, so my kids were able to listen in on a lot of the calls, and so I was hearing them throughout the day. Well, didn't Dr. Maggie say this? I think I told you my son told me one time we were talking about when I'm going to adjust some of his supplements, because after I went through the program, now I know how to test the kids myself. Some tests that their own doctors weren't willing to run, and so we were talking about adjusting some of my son's supplements because of some acne he was having, and he said, "Now, Mom, didn't Dr. Maggie say we're not supposed to be making meals of supplements?" She did.
You know, Christina, a lot of people are like, when they look at what we do, they think one of the questions people have is, oh my gosh, this is just a big play to sell us a ton of supplements. And I'm like, no, it's the opposite. It's knowing how to fix the actual root cause so you don't have to make meals of supplements. You don't have to be dependent on supplements. Supplements to me are just a Band-Aid, but they're just natural. And so if you can fix the cause and you don't need medication as a Band-Aid or natural supplements as a Band-Aid, that's ideal.
Yeah, and so he and I also talked more about, okay, meal planning. What were some ways for him to get some more vegetables in, and how to help him adjust his diet so he wasn't having to take more supplements.
Well, you know what I like about the story is, Christina, I mean, you're dealing with autoimmune disease and you had gastroparesis. And you have a child who's dealing with some behavioral issues too. This is a really common pattern. People with autoimmune disease don't know it's related.
Yes, and they, it's become really interesting to me. One of my children has, it's been very hard to eliminate gluten. She doesn't want to let it go. But it's interesting because when she's gone off of it for periods of time, it's like it's instant. If she turns around and has gluten, it's like night and day. I can see such a difference in her behavior. She doesn't want to see it, but I see it. So for my son, it's more obvious that he notices immediately that the way he feels when he eats it.
This is Hunter?
Yes, and that connection.
See, I love that. When you actually have a child link the cause with the effect and they choose themselves, that's the most powerful thing that you could do to teach your child that.
Yes. And that makes them like tempted when they're out in public too, because they know how it's going to make them feel if they eat something like that.
Yeah, I love that, and great. And so Dawn just was mentioning that this is the least amount of supplements she's ever taken in 20 years after being through the program. What I want you guys to do is that if you guys want to learn more about the program, is go to drmaggieyu.com. /live, and there's a red button there. If you have questions that we didn't answer on this call, go ahead and you want to learn more about the program, you can click book a call with us. You can schedule a call. Actually, Elsa is the one who's you're going to be talking to, and she's our client coordinator to help answer a lot of these questions about our program, to learn more about our program. You could also click a link there to actually watch our training to know how we put all these pieces together. Patricia says, Patricia, you have a comment to add? Go ahead, Patricia.
Hi, I was just going to add, we've talked about making meals and supplements and that sort of thing. And after going through the program, it did take me a while to get to the point where I'm at now, but I'm on fewer medications. I'm on fewer supplements, and I feel great about it. I never liked taking medicine, so having to do that was really hard. And now that I understand more, I can ask better questions. I can have better conversations. I can better control what I put into my body. And I also know when I don't need something. And before going through the program, honestly, I didn't have that knowledge. I didn't have that power. Now I feel more powerful. I feel more in control. And I really feel better.
Thank you, Patricia, for that. I love that. We have in our Facebook comments, Kylie, who's an alumni from our program, Kylie Johnson. She says that my niece is suffering quite a lot from anxiety and struggles with sleeping. After doing this program, I'm very aware of what is most likely affecting her. Just the other day, I realized she's been having a whey protein shake and knew that it wasn't ideal. And my sister did say she's worse since she started the whey protein shake. No surprise there. My question is, assuming whey is a big problem, would it be best for her to avoid all dairy? I love some of these questions, but here's the thing is, this is why we use data in our program. We don't guess here, okay? These are really big decisions, and you're already dealing with kids who not only have behavioral issues, but a lot of them have really big food aversions and preferences and rebellion issues. And so for me, the use of data and teaching parents and the kids how to use this data is really key. So there's no way, Kylie, I would know how to answer that, or anybody would answer that without knowing the exact data. And that's why in our program, we use specifically a test for people with autoimmunity that works and provides really accurate, fast, actionable data to even break down all the different pieces of dairy, because you may be able to have whey, but you can't have casein, or you may be able to have goat, but you can't have, butter. There's a lot of different ways with which this data is really helpful to keep variety. And the process teaches not only you, but also your children as well. So they have buy-in, and they can see some immediate cause and effect as a result of it. So that's a great question. Someone said, there's another question. Rooster, I'm going to have you unmute yourself and ask this question. Rooster's in our audience, and I'm going to have him ask us this question. Maybe he can't unmute himself. The question is, my 4-year-old son has impulsive behavioral issues, and his teacher is suggesting it might be something organic going on, and now I question autoimmune. Meaning, I'm assuming the question is organic, meaning something health-related. And I'm going to tell you this 4-year-old impulsivity question, I'm going to tell you that it's really important. And something to think about when you're thinking about autoimmunity is in the adults, so Rooster, you or mom or in the family, you'll see a history of autoimmunity. So there'll be diabetes in the family, there'll be rheumatoid arthritis, multiple sclerosis, there'll be hormone problems in mom, hormone problems in dad. There are some things that will point to the fact that your child's issues are most likely related with autoimmune issues. So I would to say that these impulsivity in 4-year-old, take it as an early warning signal that this is there's something huge in health going on, and doing something like what we do in our program. We're looking at the vitamins that affect autoimmunity. We're looking at food mapping in the children. We're looking at hormones in some of our teenagers. All these pieces are all tied together, and blood sugar is huge in a 4-year-old, by the way. So that's huge. A lot of people don't even understand the role of blood sugar in behavioral issues in kids. What about the whole, Don, you have a question there, Don. I'm going to mute you, Don. What's your question?
Well, I speak with a lot of other adults that they'll say, oh, when I was a kid, I had such and such allergy, but I grew out of it. And the reality is that because they're uneducated, in a lot of instances, what I'm seeing is they have an autoimmunity, they have infection, what have you. And the reality is that a lot of these allergens that typical MDs and typical thinking appear to say that they grow out of it, or they have grown out of it, is that their body's just adjusted to mask it, and they've gotten so used to the issues, if you will, and how it feels, but yet it manifests in different ways as our bodies change, grow, and mature.
So this question really is about, can kids outgrow their allergies or intolerances? And the answer is yes. So some children, many children, may have certain type of intolerances at 6 or 7, but when you retest them at age 10 or 12, they could have grown out of certain ones, or they have additional different ones. That can happen because the challenges to their immune system is changing as they're growing. So these triggers in our environment and our food as they change can trigger additional allergies, and some things that they're allergies or intolerant to in the past, they can actually develop decreased response to over time, because it's all about allergic load. These things like the environmental allergies, the food allergies, all add to each other. And what I find is that if you don't know what they are, then it's almost like they're always sitting really high, then every little thing is triggering something. But when you actually start removing a lot of these allergic load because you have data to do it, even if they get introduced to it later, because there isn't all these other things adding to it, what you find is that they may not have a reaction to it at a later time. And they might even be able to tolerate small amounts of it without any problem. But that's why using data is really important, and using a scientific approach to how you reintroduce it gives you valuable data to know maybe it's an amount for some kids. Okay, and a couple of years later, retesting in children is important when you know, oh, they actually did outgrow this one, or this is a new one. Okay, so some, Elsa, you're about to say something there.
Yeah, I was just going to say too that I think it's really important that we all listen as parents to our instincts, and we really need to exercise that muscle, because a lot of doctors, Ani's pediatrician, did not ever rolled their eyes at me when I suggested food might be playing a role in some capacity. With my older daughter's ADD and anxiety, she has severe anxiety or had it. We learned that there were autoimmune issues related to that, and that was poo-pooed by the doctors. Their solution was take Miralax and see a therapist. While I think therapy can be great, and mindset work is huge, there was clearly an underlying physical problem going on, and for her, it was hormones, food, and gut health.
And think about how much money people spend going to doctors to get a diagnosis of ADD or anxiety or depression, and think about how much is spent in therapy and how much time is spent doing that. I mean, look at Ani's problem that she's had for a year, and it was turned around in 4 days. You know, so for me, there's like a huge financial cost to the Band-Aids that we provide to treat these really life-altering issues, behavioral issues in our children. And it can be turned around as fast as 4 days, Elsa. And people don't know that. So great. So thank you, everybody, for joining us for tonight's show. To learn more about our program, you can go to drmaggie.com, and you can watch our free training to see what we're all about. If you want to learn more about us, you can also book a call with us, and you'll be speaking with Elsa, actually, to learn more about our program and all the pieces that are actually in it that's needed to turn things around. But think about it. These things can change in as early as in a couple days. And our program's 2 months, and it's about 8 weeks, and we really see dramatic, huge turnarounds. And if you join our Facebook group right now, you can also see there's a lot of videos with parents who've been through our program, families who've been through our program, and what results that they saw in their kids' behavior in a very short period of time. So thanks for joining us, everybody, and have a great night. Thanks, Patricia. Keep up the great work. Thanks, guys, for joining us in our green room as well. Have a great night, everybody.